Hello, this presentation is about factors affecting image quality in dental radiography. The presentation is geared toward the dental assisting student. First, let's look at equipment settings and techniques and how that affects our dental radiography images. So we have our dental x-ray unit, and a very important part of obtaining diagnostic quality x-ray units is, of course, to make sure that our unit is in good working order. Of course, we want to have it inspected by a physicist that uh, you can usually obtain an inspection from your county radiological division, um, and want to make sure that your unit is in good working order, and that includes that your PID is stable. So you see I have a little sign here that says, hey, I'm moving. We call this PID drift. So if you're positioning your PID toward your patient's face and teeth and the image receptor and it's moving, then you may need to have your PID arm and extension bar here adjusted. Sometimes if you have the bar holding the tube housing too close to the um, extension bar, it can cause a drift because it has kind of an elasticity. So you don't want to have those too close together. They're meant to have some space in between these two bars here. So PID drift definitely will give you a blurry image, affect the sharpness of your image. The other area or part of the X-ray unit is the control panel. So here we have some examples of different control panels. It usually has an off-on switch that's going to provide electricity to the X-ray unit, and then it has some various controls. One of them is the milliamperage. The milliamperage is the control that affects the quantity of the x-rays that are produced, or the radiation. This is usually preset by the manufacturer, and it is represented by either 7 milliamps or 15 milliamps. And the milliamperage, or the MAs, also affect the density of the image. So the density meaning how light, how dark the image is. Another control is the kilovoltage, or kVp, kilovoltage peak. And this is the quality of the radiation. This is also usually preset by the manufacturer, but it can be adjusted. It is represented by a number, either 60 kVp or 70 kVp. And this affects the contrast of the image. So the contrast is the varying shades of gray and white and black on a dental image. Now sometimes you need to have more kilovoltage for denser objects, such as different people have different density of bone. So in this particular panel, I know it's really small, but a lot of times they're represented by a little icon of a body. So you might have like a bigger image, a big body versus a little body. So certainly working in pediatrics, you could reduce the kilovoltage, or if you have someone who is a big person. Now, I'm not talking about weight, but their stature. They're just a very big person. And or sometimes we say big boned. I mean, they're just a large person. Then they may need to have, they may have denser bone, so you may need to increase the kVp, and that affects the contrast. Then we have the timer, and there is a timer. Usually we know that as impulses, or refer to it as impulses, which are fractions of a second. So with this particular panel, they have icons of different images of a bite wing, of a maxillary molar, mandibular molar, and then anterior teeth. And so you can change the impulses for how much exposure is needed for a particular area. Or you could change the impulses on any of these two machines. Another part of the X-ray control panel, or that actually is part of the X-ray unit, is the activation button, also known as the exposure button. This is normally positioned outside of the room of the dental X-ray unit because we, as the dental radiographer or the operator, are around X-rays much of the day. We take usually X-rays on many patients during the day. So we want to protect ourselves from the dental radiation, and so we are also required, mandated by law, by usually the dental boards and the departments of radiological uh, divisions or Department of Radiology in your state to be a certain spacing away from the dental x-ray unit. So our activation buttons are usually outside of the room, and that's the only time when we press that button that x-rays are actually produced in the tube housing. So the effects of equipment settings on dental images. We talked about the MA affecting the density or the degree of darkness or lightness. Now, there could be other factors. If you're using film and your processing solutions are the wrong temperature or not at the right level, you could have density, your image affected, and it would give you either a light or a dark image. Contrast. So contrast was affected by the power of the X-ray, the kilovoltage peak, the quality. And so this can be adjusted so that you have varying shades of black, white, and gray. So you can have short contrast or long contrast, how dark it is. And this is really a preference of the doctor in viewing their radiographic images. What's nice about digital X-ray systems is that your contrast can be adjusted after the exposure through your dental image software. And then the sharpness or the definition of an image. This one is blurry and the image is not sharp. This image is not sharp, and so this has to do with PID movement or even the image receptor itself being moved by the patient's tongue, or the patient's head is moving. So we do need to keep an eye on our patient when we go outside of the room to activate the exposure button, that we need to keep and make sure that our patient is still. Now let's look at some techniques which are principles of shadow casting. Now, simple shadow casting, perhaps you've seen people do shadow puppets. This is actually an example of shadow casting, which we're going to see that dental x-rays actually cast a shadow onto an image receptor. And so in this case, we have a flashlight or a source of light pointing toward a screen, and the person's hand in various positions will cast a shadow that often looks like a bird, an animal. This one looks like a little bird on a perch. And you can see in this one that it's a little fuzzy. So this either means that the hands are close to the screen or too far away, and or the light source is too far away. Here we have a little clearer image, so that means that these hands are in a perfect position or closeness to the screen or the wall, and so is the light because it's much more clear. It's not as fuzzy as this first one. We also have shadow casting from the sun. So when you see your shadow on the ground, depending on where the sun is, you could either have a longer shadow or a smaller shadow. Same thing as a shadow of a tree, depending on the position of the sun, whether it's short or long. So we can use this same principle in dental radiography. So let's see how shadow casting rules apply to dental radiography. One of them is a variation in distance, and we have variations from a few areas. The ideal target surface distance is where the tungsten target, remember the focal point on the tungsten target, is in relationship, and we're going to use the PID as the length, excuse me, a relationship to the tooth, which is the image, pardon me, and the image receptor, which is either the film or the sensor. So with the image receptor being very close to the tooth, which is ideal, and the PID being close to the face of the patient, you will get a diagnostic quality image, very clear, very sharp image. If the object, being the tooth, is far away from the image receptor, even if the PID is close to the face, you may get what's called a penumbra, or a blurry outline or a fuzziness to the image, just as we saw in this puppet, shadow puppet, where it's a little fuzzy. If you have the target image, so the target but represented by the PID is far away from the object and the image receptor, you will also have a penumbra, or a fuzzy type image. Now, if you have the image receptor and the object close together, and you lengthen the PID, even though your target, tungsten target, your target is far away from your object and your image receptor, the long PID keeps those dental x-rays parallel. That will also result in a quality image. So we have variations in distance called target surface distance, which is the ideal, and that target surface distance is really represented by the length of the PID. We have object image receptor distance, where if your object is too far away from your image receptor, it could result in a penumbra, or a blurry, fuzzy outline of the image. Or if your PID, your target, representing the length of your target area, is too far away from your object and your image receptor, you will also get a penumbra. Or if you extend the PID with a long PID, which is recommended, it keeps the x-rays parallel and therefore will result in a clear image. Other variations or other factors affecting quality image is, let's go over here to motion. We talked about PID drift will cause a fuzzy image, patients moving their head, or moving the image receptor with their tongue. Any motion like that will cause a penumbra, a fuzzy image, or a very blurry image. Another factor would be, which relates to actually the target image receptor distance, uses something called the inverse square law. And this is a physical law in physics, and it just states that the farther away your target source is, the more physical quantity, or in this case, the more x-rays are needed. And don't get hung up too much on inverse square law. Just know that if your PID's farther away from your object in your image receptor, then you may need to, in order to get a clear image, you would need to have more radiation, so expose your patient more. So that's why we want to keep our PID close to the face, our image receptor close to the tooth. So let's review. In summary, to achieve diagnostic quality images, we want to maintain our equipment. We need to check the X-ray unit settings and adjust as needed. We need to use appropriate shadow casting principles, which are the proper distances. Use holders and techniques to stabilize the image receptor and also work with your patient. And use appropriate exposing techniques such as the paralleling or the bisecting technique. Thank you very much for your attention, and I hope you learned a little bit or a lot about factors affecting image quality in dental radiography. Thank you.